We move on to the second speaker. Our second speaker is engineer Abdulrahman Shahat. Mr. Shahat is the Director of Information Technology at Ad-Dar Hospital and Medical Center. He will be speaking to us about utilization AI in the medical field. Welcome, Dr. Shahat. Please proceed with your talk. The floor is yours.
Thank you, and thank you for the organizing committee for this amazing conference. Today we will be talking about utilizing AI in the pediatric care. In the beginning, as a disclosure, there is no financial interest or agreement or affiliation within a common organization that might have any material interest in the subject in my presentation. We'll talk about introduction to AI in pediatrics. We'll talk about key application of AI, AI in pediatric diagnosis, and enhancing patient care with AI, and ethical consideration and challenges, and finally, implementation of strategies. Introduction to AI. What is AI? Is an artificial intelligence in healthcare referred to the use of algorithm and software approximate human congestion in the analysis, interpretation, and comprehension of complex medical data that need fast analyzing, and that might take human a little bit longer time with the doctor to relieve them from the pain of reviewing multiple data from multiple either hospital or multiple patient. The AI will analyze those data, and after that it will give a brief or a suggestion of diagnosis for the doctors, and it will minimize the time that needs for diagnosis. Why pediatric? There is a specific unique challenge in pediatric care due to the growth, development, and there is less data available to compare to adults. Usually for adults, people can use medical devices, and you can get so many data from it. In pediatric care right now, there is no medical devices, or there is a limitation of medical devices that can be worked with our pediatric patients. Some of the key application of AI diagnostic assistance, that an AI algorithm will help to analyze medical images like X-ray. If there are 1,000 X-ray that came to a pediatric hospital, the AI can prioritize each X-ray with a diagnosis, and it will refer them for MRI faster and more accurate diagnosis for conditions like congestive heart diseases or tumors. And it will help the doctors first to see the high impacted cases, and after that it will learn more from the data that is corrected based on the doctor diagnosis. That doesn't mean that the doctor is limited or it's not being used for reviewing the X-ray. There are other people that will use the data or the X-ray images for it. And after that, the AI will learn more and more, and hopefully the error rate will be close to zero. Another key application, predictive analysis, like forecasting disease progression, potential complication in chronic condition like diabetes, or like likelihood of ICU admission. Personalized medicine, like for tailoring treatment plan based on genetic information, patient history, and predicted the response to medication. Sometimes each patient responds differently to a certain medication. With the use of AI, now it's being used in adults, but I don't think it's being used in pediatric. You can tailor it based on the genetics of the patient themselves. You can enter the DNA of the patient, and after that, it will tell you what's the success rate for using this medication or this chemotherapy for the patient. Finally, administrative efficiency, automating administrative tasks like scheduling, patient triage, and EHR data management. Usually, when a patient comes to the ER, you can have within your application set of questions that you can ask parents, and after that you can triage the patient or the pediatric patient according to that criteria. Even you can give them that before they come to the hospital, and it will give them the time for if they want to go to talk to a doctor virtually, or they need to come to the emergency room. In the AI and pediatric diagnosis, there are multiple case studies, but the most important thing is the use of AI in premature babies, and for you can also detect retinopathy from premature from X-ray, from retinal images. You can use that from your home. You don't need to come to the hospital. There are some multiple applications right now for adults, and they are converting to be for pediatrics. One of them is SEDIM. You can diagnose multiple diseases through the image of the retina. You can take it with your phone, and you can try it right now with SEDIM AI. There are AI models for predicting asthma excursion through wearable technology data, and it can be installed within the confines of the home. And the parents can be involved within this data, and if there is any alert, it will alert them directly. And one of the benefits for it is the early detection of any diseases. If the patient will have a heart disease or have a heart murmur or anything, the pediatric patient can have a wearable device like the Apple Watch or other devices that tailor for pediatrics, and it will tell them if there is an irregular heartbeat or an issue, and also it will reduce the diagnostic of errors. Enhancing patient care, you can use it for remote monitoring. Instead of the pediatric patients staying at home, staying at the hospital, they can stay at home, and it can be monitored continuously through the vital signs, especially for the patient with chronic diseases, for diabetes and for heart diseases. Instead of them being in the hospital contracting other disease within the hospital, since there is a risk of contracting multiple diseases with either if you're in the ER or in the admission. You can be at home, and you can monitor the child through those wearable devices. You can use also chatbot for health education. If a parent have a question about dietary supplements or certain food or allergy, you can use the chatbot to provide the health information to a parent in an understandable format, improving patient engagement and compliance. Of course, the use of AI, it needs ethical consideration and challenges because the access of the data, it needs to be limited only to the health practitioner. It should not be used without the consent of the patient. We have the data privacy, protecting sensitive pediatric data from breach, and hospitals are prone to multiple security attack, and you need to have those data protected at all time. Sometimes the AI will be biased and fairness according to where it learned the data, because the AI alone, it will not have any knowledge unless you feed that knowledge. So if you bring data from outside of the kingdom, or you bring it from China or from India, it will be tailored to those regions. So you need to teach it some information regarding that, some information from within the region, so it will give you accurate and more fair data. You need to have human oversight, and they need to have a clinician to review the AI decision periodically to ensure patient safety. You need to have a regulatory framework to navigate complex regulatory landscape for AI in medical devices. Finally, implementing strategies, you need to train the healthcare provider to how to use the AI. because the AI has limitation, and as much as you can feed it data, it will give you accurate results. Otherwise, it will not give you the outcome that you need, and you need to work hand in hand between between the AI and the clinician, nurses, hospital administration, parents. Everybody need to get trained on the use of AI. Patient and parent education, you need to have a clear communication about how AI is used in the child's care, and it's not a supplement or it's not subtracting the doctor. You need to have the doctor with you at all time until you feel comfortable with the AI predicting or alerting you, and after that you can rely on it as you go on. That doesn't mean you don't rely on your doctor, but the percentage of relying on the doctor, it will go lower. Collaborative development, you can work with the AI developer to ensure tool pediatric specific needs. As we said in the beginning, the pediatric needs is different than the adult, and the kind of data, like I'll give you a brief example, the growth chart that we have in the kingdom right now, it's tailored on the European and American standard. And we have a different growth chart in here in the kingdom, the physique and also the genetics. Also, if you look into China, if you look into India, there are multiple information or multiple growth charts for our patients. And you need to make sure that all of these are tailored to within your region. And also we have a huge obstruction, which is the Arabic language. We have limited medical information in the Arabic language, and we need to enhance those information, and we need to feed it more with the help of the patient, with the help of the parent, with the help of the healthcare providers, and we need to Arabize as much as possible our health medical records. In conclusion, the AI will hold transformative potential in pediatric healthcare by improving diagnostic, treatment, personalization, and patient management. And we call to action to embrace the AI technology. People will usually refrain from using new technologies and will be resistant to change, but you need to see how can those tools will help you in the pediatric care or in adult care or in the healthcare industry as a whole. And as we saw right now, there are ChatGPT, there is Gork. If you go right now and ask them about anything, it will give you an answer. If you ask them to generate an image, it will generate an image for you. As you can see, the image that is here right now, it's generated by AI, by prompting that the use of robotic within the AI, within the child care. And it gave me that information or give me that image within seconds. So as I said at the beginning, to embrace the AI technology responsibility to enhance pediatric care while being vigilant about ethical implications. Ethical, as Saudi Arabia right now, at the end or mid of this year, there was a survey and understanding of multiple right now working on ethics and permissions to use AI in medical care. Thank you for listening, and if you have questions, please let me know. Thank you.
Yes, thank you very much, Mr. Shahad. It's very informative, and it's the trendy thing to talk about AI in healthcare. I have two quick questions for you. How safe is the AI to be used in private hospitals?
Right, AI is being used as all it's not making all of bugs, everything that
You're
will
breaking, Mr. Shahad. We cannot hear you well.
sorry. Right now, with the with the private hospital or government hospital have a very big understanding of AI. It will be used only on monitoring cases. It does not use for diagnosing doctors, and it needs to have it needs to follow all of the rules and regulation of this Saudi Kingdom.
Thank you very much. I have another question for you. Actually, the audience is asking, could you please share with us the name of the softwares that you have listed to be used in AI as diagnostic and, assisting in monitoring?
It's called Sadim. The tool, you can go, it will, you will get, I will say, somebody saying that which website you can use Gork, or you can, which is from platform of, and you can use ChatGPT, but those are only for understanding of the AI, understanding the information. You cannot feed it multiple questions and it will give you the answer for diagnosis. They're saying that, are you aware of any health facility in KSA who are actually using AI in pediatrics? You can use, they are starting to use it, which is King Faisal Hospital. They're using it for patient education and for reviewing some x-rays. As far as I know, this is the only hospital that's being used.
Thank you very much, Engineer Shahat. We will move on to the panel
Right,
discussion.
name
Thank you very much. We appreciate your talk. Thank you.